Hello and welcome, friends. Today we will be continuing in the same sequence of the gunshot injuries, and we will be coming to the very important topic, that is examination of gunshot injuries. Very few but important details we have to consider in this examination, and we are having uh, gunshot injuries including the shotgun or rifled weapon. The post-mortem examination of a firearm victim presents some peculiar problems over and above the usual medical legal autopsy. In usual medical autopsy, you say it is a laceration, it is a abrasion, it is some type of other blunt weapon injury. But in case of gunshot injuries, due to the various particles, that is dust, that is soot particle, smoke, as well as the projectile, that is the bullet. We will be examining a lot of things other than the wound, that is the examination of the clothing and x-ray of the body to determine the number of where the bullet or the pellet is lying, and findings regarding the injuries showing external evidence of the injury, whether the injury is the entry wound or the exit wound, or depending upon the and the path is it has made, and the try to we will be trying to have a trajectory of the gunshot wound, and possible the direction of the wound, which a bullet which has direction of the bullet which it has traveled, and also some part in the collection and preservation and dispatch of the exhibit or the evidence which we have collected from the body. Important examination of the clothings. Doctor must be attentive in finding bullets. If it is in the cloth, we should be concentrating on the finding of the bullets and its residues on the clothing. Bullet and its residues. Sometimes the fragments of the bullets are present in the clothes, and sometimes the bullet is lying in the clothing. So now nowadays people are wearing denim pants and jackets, and they are very hard to penetrate. So they can get entangled into that, and we should be very much cautious into it. Any distortion of clothing, it means any tearing or any burning in the cloth or any other material which is may have been brought by the bullet or the pellets, and the extent of manner of blood staining whenever there is an injury which involves the clothes, then there are chances of blood staining, blood swelling, greasing in the clothes, smearing and smudging with mud or grease, number of locations of defect produced by the missiles, number of injuries in the body, number of injuries in the body, like this. If a number of pellets have penetrated, then we should count, or we if multiple gunshot injuries, then we should count each and every gunshot and try to label it with the anatomical landmark, like distance from this point. We should be very much particular about the location of these defects, because that will help in finding out the assailant, finding out the angle of the weapon, and finding out the various other forensic science evidences. This is the defect in the cloth. We can see there is a burning here, a burning of the clothes, tearing and burning. Then we have mm, collars. Then we have collars. Then we have blood. which is being attached. We can see the soot particle. So different things which we can encounter in the clothes. It is very helpful whether the victim was having the clothes on, whether the victim was disrobed, or it may help in suicidal or homicidal or accidental. In suicidal, most of the time people generally don't fire over the having clothes on. They generally adopt that areas they like the forehead or somewhere else where the clothes are generally not worn. So we should be very much clear about the clothes we are examining. Again, this is the denim pant or trouser which have multiple pellet injuries. So you can see the multiple penetration. There is a blood around it. So as we have discussed, the pellets disperse with time and distance, and they can make multiple injuries instead of one single hole. Objective of examination of clothing to establish the range of discharge of firearm. So sometimes we are able to stand range of firearm means up to some extent the flames go, up to some extent the soot particles go, up to some extent other particles go like no, gunpowder go. Then they subside and only the bullet or the pellets move, and with up to some degree they go and penetrate the tissue. So we can able to identify the or somehow give the rough opinion about the manner and distribution of soot and the powder. So it can be a close range if we get soot or the powder. If we get only a grease or the abrated color, it may be a long distance or medium range, depending upon. But soot and powder generally travel up to a shorter distance. Depend about the wound of inlet and outlet, mean entry wound or exit wound. We are very we generally come along very usual topic that entry wound or the exit wound. We will be getting differences and all that, entry wound and exit wound, all that, but we should be very much be in practice to describe if it is inlet is accompanied by gunpowder or the soot particle or the abrated collar, then it is possibly in entry wound. If it is not accompanied by this, then it is possibly a exit wound. Deposition of various residues, blood wipes surrounding the entrance defect as appropriate range. Direction of bullet travel may be suggested by insertion of the fabric surrounding the inlet. Sometimes the fabric is also pushed inside, the clothes are also pushed inside the wound, and they can be also be pushed from the inside of the skin in the exit wound, depending upon the speed and the suction pressure and the negative pressure that can develop at the site. So we should be very much open minded in examining the wound. Location of the bullet is very important. If there no exit defect and no exit wound, then the in the clothing while it is present on the body, either the cloth did not cover the area of the exit, means if there is a exit wound in the body but not in the clothes, that in that case either the person was not having the cloth worn when the shot, or it has wound bullet has not penetrated the cloth. So we should be looking for the bullet. The bullet left the body with insufficient velocity to pass through the clothing. We have seen many cases in which the bullet has entry wound and exit wound. Entry wound, the cloth is also torn, but at exit wound, the cloth is not torn because at that time the bullet velocity has reduced so much so that it generally comes out of the body and does not cause any harm or any tear in the clothes. Bullet may therefore either be lying loose in the clothing, might be dropped during the transport, or during the handling of the patient in the hospital. So various circumstances may develop in case of the bullet. We should be aware of the various circumstances. Importance of X-ray examination. It is very important, especially in the autopsy, in locating the bullet or the pellet fragments or the jackets. Determine the track of the wound. If we have entry wound in the body and we have bullet somewhere lying here, then we can determine the track that it may have traveled in this direction unless until it has got any deflection on the ricochet on all that sometimes, but it may be having exit also, so bullet may have traveled through the exit. It all depends upon the penetration and entry and exit of the wound, and we have to do x-rays to locate the bullet or the pellet. Determine the defect in the bones in the area of the easily. If a bone is in between, then chances of fracture is there and deflection is there. So we can get the fracture also and the bullet lying somewhere else here also. So depending upon the various circumstances which may be happening in the body during the bullet is entering and the bullet is striking a bone or any other object and then coming back or deflecting in the different parts. So we should be very much aware and we should be able to visualize how the bullet is traveling in the body and which are the objects that can obstruct its way and make its new path. Defect scan the body in instance of bullet embolism. Sometimes bullet may penetrate into the blood vessel and can go along the flow of the blood. Then it can lead to embolism or through, and it can sometimes blood can lodge into the GI tract, and due to the GI movement it can move along the intestine. We should document these bullets where it is found and it should be sealed and handed over to the police so that it can be examined by the forensic science laboratory or the FSL people. Assessment of the entry wound. Body should be thoroughly examined to look at the wound of the entry and exit. Locate wound in relation to some fixed landmark of the body. Like we should be able to generally from the foot, we should be able to distance it from the foot. If one is 10 centimeter, like one is about 50 centimeter, another is 54 centimeter, then we can say that one is, if an entry is one is here, then we can say that the bullet has traveled like this. So we should be examining in terms of landmarks and writing it so that we can get the trajectory of the bullet, or we should be able to locate in some time later in the medical legal report that it should be properly written and so that it can be later understood also. Characteristic of entrance wound: abrasion collar will be there, powder tattooing can be seen, and abrasion ring can be there. Factors influencing the entry wound appearance is range, how much distance is there, angle, which is the gun is being fired, and the velocity with the bullet is traveling. Importance of difference of entry wound from the other trauma. If some other traumas are there, then we should be able to tell that it is by blunt force or other penetrating object instead of gunshot. How to describe a gunshot? It should be measured into centimeters, whether it is oval, whether it is circular. It should be properly named and it should be properly described. Like in addition, we'll have having blackening, tattooing, hair singeing, abrasion. It all must be described from the wound. All the things should be described and properly written. Assessment of entry wound, characteristics of entry wound are already discussed: abrasion, tearing, and avulsion. Exit wound. Different exit, differentiating exit wound from the entry wound. It is important. Generally, exit wound is everted because the skin is intact and the bullet is penetrating out. So it will tear it out. So it will be generally everting. There will be generally no blackening and tattooing and other things which are at the entry wound. Additional forensic consideration can be fractures, hematomas, organ damage that has been into the path of the uh, bullet. Description of the track of the wound, that is another, from entry to exit, whether it is straight or somewhere ricocheted and going somewhere else, then we should be able to make a complete path or describe a path. We should do dissection in layers so that we will should be able to make the correct interpretation, and we should not be probing it. Instead of dissecting in, we should not be probing it, because by probing we can make a false path. Ricocheting phenomena should be kept in mind. We have come across a lot of the gunshot injuries in which bullet has ricocheted from the chest cavity and came back from the same pathway which was the entry pathway. And we have another phenomena in the various phenomena in the cranial cavity, that bullet goes in and it strikes through the skull and comes in the different directions. So we should be having in mind all such things while examining the patient of a gunshot wound. Collection, preservation, and dispatching of exhibit. This is another very strong and very cumbersome work on ourselves. We should be having heavy duty gloves, should be worn while handling the projectile, because projectile becomes sharp when it is fragmented. Prior radiography should be done to ensure whether the bullet or pellet where it is lying. Rubber tipped extractor. The extractor forceps should be rubber tipped so that it cannot leaves its own mark on the bullet. Projectile should be examined for any trace evidence such as fiberglass pieces, paint, etc. Then it may be dried into in open. If needed, packed. The bullet should be packed and fragment should be dried and packed. It should be packed into a hard plastic container. It should be padded with some soft material so that further new prints or um, new marks should not be developed. Before packing, blood should be marked on, on its base for future identification, and it should be particularly case and warning should be present that it is a biohazard. Okay. Causes of death in gunshot. Most of the common cause is hemorrhage, because there is excessive bleeding. Then, depending upon the organ and the blood vessel involved, death may occur within few minutes. Brain takes around 4 to 5 to 10 minutes to stop. Heart takes several minutes to stop. So it's most of the time the causes of death is in gunshot injuries is generally hemorrhage and the ischemia to the heart or the ischemia to the brain. Clues about the manner of death, it is very difficult to comment as a forensic pathologist because we should not be considering about the manner of the death, but sometimes some of the areas like certain pattern of injury include either indicate consistent method of cause like injury to the forehead, right-handed person, closed or contact wound with a suicidal note and all thing can we can draw some opinion, but we should refrain from giving the manner of death. With this, we are concluding the gunshot part or firearm part. We will be having in the coming lecture about the explosive injuries from the explosions, then other regional injuries. Then we have a lot to come in the coming lectures. Thank you very much.